Okay, so today we are going to deal with the posterior triangle of the neck. As I mentioned before, that the posterior triangle of the neck is just posterior to the sternocleidomastoid muscle. This is the sternocleidomastoid muscle. And although it's named posterior triangle, but it's actually can be seen anteriorly, and usually it is lateral to the on the lateral side of the neck. It is not behind the neck. So don't confuse the name posterior triangle as if it is located posterior to the neck. It is lateral to the neck. Also, I would like you to see that the floor of the triangle here, these muscles that form the floor of the triangle, they are not in a single plane, they are curved. And so the most of the diagrams that you see in the atlases or textbooks, they are a little bit distorted because they don't have a three-dimensional perception. So the boundaries of this triangle anteriorly is the sternocleidomastoid, as its name indicates. It's attached to the sternum, clavicle, sternocleido, and then to the mastoid process of the temporal bone. Posteriorly here, this is the anterior border of the trapezius muscle, and inferiorly that will be the middle third of the clavicle, because the sternocleidomastoid is attached to the medial third of the clavicle, trapezius is attached to the lateral third of the clavicle, and this leaves the middle third of the clavicle as bare bone, forming the floor, forming the base of the inferior of the posterior triangle of the neck. Now, I'm going to reflect the sternocleidomastoid muscle. Before reflecting the sternocleidomastoid muscle, you can see here that there are some branches, cutaneous nerves from the cervical plexus, like this one, which curves upwards and anteriorly on sternocleidomastoid muscle. This is the great auricular nerve. This nerve supplies the skin here. This is the platysma, I'm reflecting it. And so the great auricular nerve supplies the skin over the angle of the mandible. It's a branch of the cervical plexus. These branches from the cervical plexus, they arise from the posterior aspect of the sternocleidomastoid muscle. One of them is this. There are others like this one and these branches. They go downwards to the shoulder region. They are called supraclavicular nerves. And you might probably see on another cadaver, another one going transversely there, transverse in the neck. It's called the transverse cervical nerve. This is another one from the, no, let's skip it. Okay, so these are the supraclavicular, great auricular, transverse cervical. These are branches of the cervical plexus. You can see here the cervical plexus. Other parts of the cervical plexus you can be seen here. I'm reflecting the sternocleidomastoid, and you can see now the muscles on the floor of the posterior triangle of the neck. This is the omohyoid actually, and this is the superior belly of omohyoid, and the central tendon, and the inferior belly of omohyoid. It actually divides the posterior triangle into a supraclavicular and occipital triangles for descriptive purposes, and then returning back to the muscles on the floor of the posterior triangle. These are the scalene muscles. So this one is the scalenus anterior muscle, and you can see that it goes downward to be attached to the first rib. I will show that to you in a moment. And then behind it is the scalenus medius muscle. So this one is the scalenus medius. The characteristic thing that I would like you to notice here is that between scalenus anterior and scalenus medius, you will find these nerves. These are the roots of the brachial plexus. We are going to study the brachial plexus later on. And so you can see here, the roots of the brachial plexus are sandwiched between scalenus anterior and scalenus medius. The brachial plexus arises from cervical nerves C5, 6, 7, 8, and T1, and it's the plexus, the network of nerves that supplies the upper limb. So again, scalenus anterior, scalenus medius, in between are the roots of the brachial plexus. A very characteristic anatomical relationship here, and before continuing to deal with the muscles on the floor of the posterior triangle, is this nerve. Now this nerve, as you can see, if you follow it upwards, you will find that it arises from the cervical plexus, and it is a branch of the cervical plexus. It goes downwards vertically, and as you can see, scalenus anterior is oblique, but the nerve is vertical, so it crosses scalenus anterior from lateral to medial. This nerve continues its journey through the superior thoracic aperture into the superior mediastinum, and then continues down to the diaphragm. This is the phrenic nerve. Remember, the phrenic nerve is a branch of C3, mainly 4, C3, 4, and 5. So C3 and 4 are the roots of the cervical plexus. Cervical plexus is formed from C1 to C4, and then from C5 to T1, it is the brachial plexus. So this nerve is the phrenic nerve. Characteristically, it crosses in front of scalenus anterior muscle, while behind the scalenus anterior are the roots of the brachial plexus. So again, scalenus anterior, scalenus medius, and then we have scalenus posterior. This will be scalenus posterior. It is a very small muscle. Sometimes it's not easily seen, so this one is the scalenus posterior muscle, and then behind it is levator scapulae. So this will be levator scapulae muscle. Usually it is splitted. As you can see here, there is a split in the levator scapulae muscle, and then the muscle, this one is also levator scapulae, so both of them are levator scapulae. And then very deep and posterior in the triangle is the splenius capitis. It's not very clearly seen here. I would say that all of this is levator scapulae muscle. These two slips of muscle fibers are the levator scapulae muscle. And here you will find that there is a nerve. This nerve is passing through sternocleidomastoid muscle. See here? It leaves the posterior aspect of the sternocleidomastoid muscle between its upper and middle third, crosses the posterior triangle of the neck, this one. It is superficial to the fascia, to the prevertebral fascia that plasters these muscles on the floor of the posterior triangle. And then you can see it here, it's disappearing in trapezius muscle, passing beneath the trapezius muscle at the junction of its lower third and middle third. So this is the accessory nerve, the spinal root of the accessory nerve. It carries the motor fibers to supply both sternocleidomastoid and trapezius muscle. I would like to remind you that these muscles on the floor of the posterior triangle, they are all plastered by deep fascia of the neck, which is called the prevertebral fascia, while the roof of the posterior triangle is the investing layer of deep cervical fascia that splits to enclose sternocleidomastoid anteriorly and then trapezius posteriorly. So actually the accessory nerve is not plastered by the prevertebral fascia. It is superficial to the prevertebral fascia, between the prevertebral fascia and the investing layer. While these nerves that, like the phrenic nerve, the roots of the brachial plexus, they are plastered by the prevertebral fascia. And in fact, the roots of the brachial plexus, or the brachial plexus that is going to be formed from the roots, they are going to drag with them an extension of the prevertebral fascia, as we will study that later on when we deal with the upper limb, the overview of the upper limb. So this is like a brief demonstration of some of the important structures that you will find in the posterior triangle of the neck. If you look here, again, behind scalenus anterior muscle, it is not only the roots of the brachial plexus, but you can see here, this is a vessel, this is an artery here, deeper, lower down. This is the subclavian artery, and it's related to the first rib. Okay? We'll go to the other side when we'll try to find some other structures on the other side. So here we can see the carotid sheath. That is the common carotid, the internal jugular vein. Here's the ansa cervicalis. They can be seen if we reflect the sternocleidomastoid muscle, as I'm doing right now. And then you can see the muscles and the posterior triangle. This one is scalenus anterior, very characteristic. It's in front of the roots of the brachial plexus. And this nerve that passes in front of the scalenus anterior muscle is the phrenic nerve. See, this one is the phrenic. These are the roots of the brachial plexus. And these are the cutaneous branches from the cervical plexus, like the supraclavicular, great auricular, and so on. And then this one here, don't confuse it with the branches of the cervical plexus. This is the great auricular ascending up to supply the skin over the angle of the mandible. But this one here, it crosses from behind sternocleidomastoid going to trapezius muscle. This is the accessory nerve. Of the other structures of the other nerves that you need to identify here, we have this one. And like this one is actually located within the carotid sheath. This nerve is within the carotid sheath, between the internal carotid and between the common carotid and the internal jugular vein. This is the vagus nerve going down into the thorax again. And then we have another nerve here, very deep and medial. It is located behind the carotid sheath. It is not included in the carotid sheath. This is the sympathetic trunk. If we dissect a little bit higher, you will find here that it's a little bit, there is an enlargement, although it's not very clear here, but that is a little bit enlargement, an almond-shaped enlargement here. This is the superior cervical ganglion. So this is the sympathetic trunk that ascends upwards from the thorax. This one is posterior to the carotid sheath and not included within the carotid sheath. Okay. I think we need to. Okay. So this is a plastinated specimen, and the reason that I'm showing it to you is I want you to concentrate on this area. This is the first rib, actually. And on the medial border of the first rib, here's the scalenus anterior muscle attached. So this one is scalenus anterior. Here's the first rib, upper border of the first rib. In front of scalenus anterior muscle, you can see a vessel. In fact, this vessel is a vein. If you look at it here, this is the subclavian vein joining the internal jugular vein to form the brachiocephalic vein. This is on the left side, left brachiocephalic. So the subclavian vein, in other words, it crosses the first rib, superior border of the first rib, in front of scalenus anterior muscle. And then, remember the structure that I have just shown you on the cadaver, very deep, an artery here. This is the subclavian artery. It is behind the scalenus anterior muscle. So the vein is in the front, the artery is behind the scalenus anterior. Not only the artery is behind the scalenus anterior, but remember the roots of the brachial plexus, especially T1 root, which is directly applied to the upper border of the first rib. That's why if there is an accessory rib, like cervical rib, this will cause kinking or pressure on both the subclavian artery and the roots of the brachial plexus, which are in very close proximity to the upper border of the first rib behind the scalenus anterior muscle. Probably if you study the bony features of the first rib, you will find that this is the first rib here, and that is the superior border. Here's the tubercle on the medial side. This is called the scalene tubercle. It is for the attachment of scalenus anterior muscle. And you will find that there is a very shallow impression in front of it. This will be for the subclavian vein. And behind it is another shallow impression, and that will be for the subclavian artery and the T1 root of the brachial plexus. Scalenus medius will be attached to the posterior part of the upper surface of the first rib. But this scalene tubercle here on the medial border is for the attachment of scalenus anterior muscle. We are here at the region of the root of the neck. Again, this will be the scalenus anterior muscle, and that is the phrenic nerve crossing in front of it. You have studied the phrenic nerve in the thorax. You can see it now passing in front of the root of the lung here. So this is the same phrenic nerve that we see it here in front of scalenus anterior. See that it crosses it vertically. The muscle fibers are oblique, but the nerve is vertical. Behind it is the roots of the brachial plexus. And in front of it, in front of scalenus anterior, is the subclavian vein. See, this is the vein with a blood clot inside it. It has been cut because it has a very thin wall, so easily damaged. And then behind the muscle is the artery. That's the subclavian artery. You can even trace it to the arch of the aorta. Remember that the left subclavian artery is a direct branch of the arch of the aorta. So this is the subclavian artery. One of its branches here is called the thyrocervical trunk. It supplies branches to the neck and to the thyroid gland. And this is the branch, the inferior thyroid artery, that makes an arch here to go to the thyroid gland, this one. It rises from the thyrocervical from the subclavian. Another important branch from the subclavian is this one. Here it's a little bit kinked. You can see it here. This is the vertebral artery. It goes upwards, the vertebral artery, in a triangle or an area which is sometimes referred to as a pyramidal space. It's located medial to scalenus anterior muscle. And this is one of the muscles in the front of the vertebral column in the neck. It's called the longus colli muscle. So between longus colli and scalenus anterior, you will find this artery. This is the vertebral artery, and then it disappears. It disappears because it goes through the foramen transversarium of C6 vertebra. This artery, the vertebral artery, is one of the two major sources of blood supply of the brain. So it's very important artery here. You can see, okay? So I have just mentioned the foramen transversarium. Before dealing with foramen transversarium by itself, I would like to show you a typical cervical vertebra. And like any other vertebra in the vertebral column, you have already studied the thoracic vertebrae. So a vertebra has a body. This is the body, but here the body is smaller than that of the thoracic vertebra. And it has an arch, a vertebral arch. So this is the arch, and there are processes. So this is a transverse process, this is another transverse process, and here is the spinous process. And there are superior articular and inferior articular processes. So almost the same features of a thoracic vertebra, but there are other additional characteristic features. Just to remind you that the part of the vertebral arch between the body and transverse process is called the pedicle. This is the pedicle of a vertebra, and the part between the transverse process and the spinous process is called the lamina. So here's the lamina: pedicle, lamina, lamina, and pedicle. A very characteristic feature here, which is present in all cervical vertebrae, is the presence of a foramen in the transverse process. That's why this is called foramen transversarium. And it is through this foramen that the vertebral artery and vein passes. So this is for the vertebral artery and vein, and when the vertebral artery reaches C1 vertebra, it's going to go inside the skull through foramen magnum. So foramen magnum has another structure passing through it, apart from the medulla oblongata becoming the spinal cord, and that is the two vertebral arteries. Again, I repeat that the vertebral artery is the main blood supply, one of the two main sources of blood supply of the brain, and as you have seen on the cadaver, it arises from the subclavian artery and ascends upwards. Also, I would like you to note that in this typical cervical vertebra, that the spinous process is short and bifid. It's unlike the spinous process of a thoracic vertebra, which is pointed and long. So this is short and bifid. Typical cervical vertebra, I mean C3 to C5, C3, 4, 5, and 6 vertebra. The others are atypical cervical vertebrae. So you can see here, this is the first cervical vertebra. It is the atlas vertebra. The characteristic feature about the atlas vertebra is that it doesn't have a body. It has an anterior arch, a posterior arch, and two lateral masses. You can see here the lateral mass. This is the superior surface of the lateral mass. It has a kidney-shaped, elongated articular facet that articulates with the occipital condyles, and this is called the atlanto-occipital joint. And then inferiorly, the articular surface is more or less circular and articulates with the second cervical vertebra, which is called the axis vertebra. And this is at the lateral atlanto-occipital joints, two lateral atlanto-occipital joints. Here's the anterior arch, posterior arch. Again, we have a foramen transversarium in the transverse process, here, here, and here. The second cervical vertebra is called the axis. And this is the axis. It acts as an axis for rotation of the first cervical vertebra. So here we have a joint between this process of the axis, which is called the dens or the odontoid process, because it looks like a tooth. So that's why it's called the dens or the odontoid process. And the joint here is the median atlanto-axial joint. It allows rotation. It's a pivot type of synovial joints, if you remember the introduction. Again, it has foramen transversarium, so it's a cervical vertebra. And you can see that it has the lateral masses here articulate with the atlas vertebra above, and below these are inferior articular processes that articulate with C3. So very characteristic. The axis, the second cervical vertebra, is very characteristic in shape. This odontoid process, apart from the body of the second cervical vertebra, this odontoid process, it represents the missing part of the atlas, the missing body of the atlas. The atlas has no body, and this is represented by the odontoid process of the axis. Okay, and then so these are two atypical cervical vertebrae, and then we have the other one, which is C7. If you look here, this is the atlas number 1, 2, 3, 4, 5, 6, and 7. If you look at the seventh cervical vertebra, you will find that its spinous process is long and tapered, unlike the other bifid spinous processes of other cervical vertebrae. So it might give you a false impression that it's a thoracic vertebra, but once you look at the foramen transversarium, you can easily see and you can easily decide that it's a cervical vertebra. So this is a C7 vertebra. It is called the vertebra prominens because it's a spinous process, since the spinous process is long and tapered. So if you put your finger at the back of the neck and slide it down the middle of the back of the neck, this is the first spinous process that can be felt. That's why it's called the vertebra prominens. Although, as you might notice here, that the spinous process of T1 is more prominent than this, but this vertebra, C7, is called vertebra prominens because it's the first spinous process that is prominent, that can be felt as prominent on the back of the neck. Not because it's the most prominent, but it's the first one that can be felt prominent as you slide your finger down the midline of the neck. So this one is C7. Again, I repeat that because it contains a foramen transversarium, it has a spinous process that is non-bifid, but this one is T1. Might look the same, but immediately, if you look at the transverse process, you will find that the transverse process lacks the foramen transversarium. It doesn't have foramen transversarium, and that the body here has facets for the heads of the ribs, and these are also, there's a costal facet on the transverse process, all the features of thoracic vertebrae and no feature of cervical vertebra. Okay, thank you.